Shoulder joint. Shoulder joint is present between the head of the humerus and glenoid cavity of the scapula. So the classification, the shoulder joint classification is it is a ball and socket type of the synovial joint. Synovial joint, synovial joint means freely movable joint. Freely movable joint. So classification ball and socket type of synovial joint. Articular surfaces of the synovial joint, articular surfaces of the shoulder joint are head of the humerus and glenoid cavity of the scapula. This is the scapula, this is the this is the humerus. Ligaments of the shoulder joint. So the mainly is the capsular ligament. This is the capsular ligament. So the capsular ligament is attached outer to the glenoid labrum and laterally attached to the surgical neck of the humerus and medially attached to the below the 2 centimeter of the surgical neck of the humerus. And so this capsular ligament is strengthened by the musculotendinous muscle. The muscles strengthening the capsule are the musculotendinous muscles, are also called as a rotatory cuff muscles. Those are the four muscles: supraspinatus muscle above, and subscapularis muscles in front, and infraspinatus muscle and teres minor muscles are behind. So these muscles are in the form of a cord that is called as sits muscles. After capsular ligament, another ligament, it is called attached to the acromion process and coracoid process, that is called as a coracoacromial ligament. Another one is a coracoid process to the humerus, that is called as a coracohumeral ligament. So another one is a transverse humeral ligament. This is called as a transverse to the humerus process. Another one is the glenoid cavity to the humerus is called as a glenohumeral ligament. After ligament relations, the shoulder joint relations are: this is the glenoid cavity. The glenoid cavity outside, it is called as a subscapular, surrounded by subscapular bursa. Then the should be totally surrounded by the capsular ligaments are present. So the superior relations are acromion process and coracoid process. This is a deltoid muscle. So on superiorly one muscle is present, that is called supraspinatus muscle. Below the acromion process one bursa is present, that is called subacromial bursa present. So in anterior relations are subscapular bursa, because subscapular muscles are present. Below the subscapular muscles one bursa is called as subscapular bursa. Another one is the pectoralis major muscle, axillary artery and axillary vein. These are the anterior relations. And inferior relations are axillary nerve and posterior circumflex humeral artery and lateral head of the triceps. Another one is the teres muscles. These are the inferior relations. And posterior relations are the large deltoid muscle, infraspinatus muscle and teres minor. These are the posterior relations. Nerve supply of the shoulder joint is mainly takes place by the three nerves. One is the suprascapular nerve, axillary nerve and musculocutaneous nerve. So suprascapular nerve, it is a branch from the upper trunk in brachial plexus. Axillary nerve from the branch of the posterior cord. Musculocutaneous nerve is a branch of the lateral. Shoulder joint shows maximum movements in the body. So it shows the flexion and extension, abduction, adduction, medial rotation, lateral rotation. These are the movements of the shoulder joints, and also these movements are takes place by many muscles are present. And applied aspect for the applied anatomy of the shoulder joint, it is a mainly is a dislocation of shoulder joint. So it most commonly occur in the dislocation of shoulder joint because due to the disproportionate size of the articular surfaces. So the large humerus, large head of the humerus and small cavity of the glenoid cavity. So this disproportionate size, mainly disproportionate dislocation occurs. So another one is the laxity of the joint capsule. So these two regions, mainly dislocation of shoulder joint occurs.